Hello, my name is Kara Murtha, and this is my PowerPoint presentation on Technology Needs Assessment at UPMC East Hospital. I'm sorry you couldn't attend my in-person presentation, but here is a PowerPoint and my recording. Why do we need to complete a needs assessment prior to purchasing technology? It should be used prior to large purchases to show the hospital areas of weakness and places where they need to improve. It will identify technology gaps and pinpoint areas for technology purchases that can close these gaps. And it will bring all stakeholders together that we're on the same page, sharing our voices and opinions and making a difference. This quote by Wright 2008 states, "A successful needs assessment requires a practical understanding of what is involved, the time and resources necessary to undertake assessments, and sufficient integration of results into planning." And I feel this is appropriate for the needs assessment. The key issues that we will focus on will be getting an increased amount of reimbursements from the government and federal funds, focusing on preventing readmissions and preventing hospital-acquired infections, and focusing on increasing reimbursements to the entire healthcare facility and not just UPMC East, and most importantly, improving patient safety. The two things we will focus on are decreasing readmission rates and decreasing hospital-acquired infections, focusing on C. diff and CODI urinary tract infections. The new technology for readmissions that I'd like to address is that when the patient comes through the emergency room, a task will fire for physicians and nurses. This task will state that the patient has been there in the past 30 days, when they were discharged, and their discharge diagnosis and plan after discharge. This is important to all staff, including the ER staff, because they will understand why the patient was there, and they will not have to dig through the chart to find out their last admission. They'll know at the moment of arrival. To prevent hospital-acquired infections as a C. diff, I feel that a task should fire as soon as the nurse or physician document loose stools. The current process is that the nurse or physician have to manually enter an order, therefore sometimes missing the time frame of 72 hours and making it a hospital-acquired infection. The next one is a catheter-associated urinary tract infection. I feel that as soon as the order is placed for the Foley catheter, that the task should fire for the nursing staff to collect a urine. If we would have this urine prior to inserting the catheter, it would not be a CODI infection. There are many stakeholders in this new process: nurses, physicians, CEOs, CFOs, and of course the patients. The physicians will see that care will go smoother. Things will automatically happen. Information will be at their fingertips. Nursing and physician communication will be seamless, and everybody will be on the same page. Also for nursing, tasks will be easily accessible. No wasted time calling physicians for certain orders. They will automatically fire to our task list. And the job becomes less stressful, leading to better quality of day for nursing staff. And the most important, the patients. They will see the results. They will have stool samples and urine samples sent more efficiently. Their quality of care will decrease. They will be out of the hospital quicker, and they will be treated more efficiently. CEOs and CFOs will have financial gain. They will spend money on this program, but they will see more money in reimbursements in the long run. And a timeline for this process. We do need to take time to educate all super users. A designated amount of staff members on each unit will be a super user, and we will take a month to educate all of them. Then we will educate the end users. That will be all the staff that will be using this, physicians and nurses. We will install the new technology, and then we will have super users, end users on the forefront using it. And I feel like 2 weeks on the floor, staff will get used to this new policy. How we will measure the outcomes: we will keep track and monitor all readmission rates and hospital-acquired infections pre-intervention, and post. We will be able to graph the data and present to all stakeholders. And here are references that I've used for my presentation. If you have any questions, please let me know. Thank you.